Evolution of robotic prostatectomy in North America, a historical review of the intuitive surgical Da Vinci robot and its application during radical prostatectomy for localized prostate cancer. Presentation and narration by Dr. Kevin Zorn. Since the original prototypes of the Da Vinci system in the late 1980s at the former Stanford Research Institute, under the contract of the U.S. Army, significant strides have been made. Initially funded for commercial applications and use on the battlefield, minimally invasive surgery became the spotlight of this technology in the mid-1990s. In 1995, Intuitive Surgical was founded to test this medical theory, and in 2000, the Da Vinci surgical system became the first robotic surgical system cleared by the FDA for general laparoscopic surgery. Since that time, its safety and efficacy have led to its application in thoracic, cardiac, gynecological, and urologic procedures. In no other field has the Da Vinci robot made more of an impact on surgical treatment than in the urological surgical management of prostate cancer. Over the past few years, newer instruments and equipment such as the fourth arm and high-definition optics have been added to the surgeon's armamentarium. In brief, robotic technology has built on the principles of laparoscopy, now offering the surgeon more dynamic, microscopic equipment to perform precise and delicate procedures. Aside from 7 degrees of instrument freedom, tremor reduction and motion scaling are also available. With the latest robotic model, the Da Vinci S, other utilities to facilitate surgery include the high-definition viewing, the greater optical magnification, and the additional arm, and not to mention an ergonomic surgeon console. The following video demonstrates the geographical installation of Da Vinci robots per year. Initially, robots were installed into clinical practice in 1999. Annually, a greater and greater number of units were installed, as can be seen here. It is impressive both the quantity and geographical clustering of units in only 8 years. As of the first quarter of the year 2008, a total of 867 Da Vinci robots have been installed worldwide. 75% of these robots reside in the United States. The current figure demonstrates the initial delay in international growth, likely due to cost and medical system setup. However, there appears to be an increasing gain in the last 2 to 3 years. Other than increasing robotic units being installed, the following figure demonstrates the rapid acceptance and application of the robotic approach specifically for the Da Vinci prostatectomy. The impact of the Da Vinci surgical system on urological prostate cancer practice is clearly depicted in this graph. Annual case volumes for 2005 demonstrate that the major case volume was performed by the open technique in the purple bars. Less than 1% of surgeons in red were performing pure laparoscopic radical prostatectomy. Now, looking at the 2007 and projected 2008 figures, the majority of prostate cancer surgery is being performed by the robotic technique. In only a short period of time is there now a drastic shift in practice management. As seen in the yellow bars, almost an explosive linear growth is appreciated with 63 and a projected 85% of all radical prostatectomies being done by the Da Vinci technique. As can be seen in the following graph, there are only 11 installed robots within Canada. The majorities are centered in Quebec, Ontario, Alberta, and British Columbia. These numbers will largely increase in the upcoming years.